HSA News. Coronavirus update. South Africa, the 12th of March 2020. On Thursday, the Department of Health announced 4 more new confirmed cases of the coronavirus in South Africa, bringing the total to 17. The new 4 cases are a 38-year-old male from Durban who lives in Turkey and was visiting his family in South Africa has tested positive. He had traveled to the UK and returned to South Africa on the 7th of March. A 27-year-old female from Mpumalanga who had traveled to the US has been diagnosed with the virus. She returned to the country on Saturday the 7th of March. In Johannesburg, a 43-year-old male traveled to New York via Dubai and returned to South Africa on Sunday the 8th of March. In the Free State, a 32-year-old male who came into contact with a Chinese businessman has also been diagnosed with COVID-19. This is the first case of local transmission, as all others have been by patients who had traveled abroad. 6 cases of COVID-19 have been confirmed in South Africa on the 11th of March by the Minister of Health Zweli Mkhwezi, whom announced it in a statement on Wednesday morning. According to the statement, 4 of the new cases are in Gauteng, 1 in KwaZulu-Natal and 1 in the Western Cape. All of the patients had recently traveled to Europe. The Gauteng cases include a 33-year-old woman, who returned from Italy on the 1st of March, a couple aged 34 and 33 who returned from Germany on the 9th of March, and a 57-year-old man who had traveled to Austria and Italy and returned on the 9th of March. In KwaZulu-Natal, a 40-year-old man who had traveled to Portugal tested positive for COVID-19 on his return to South Africa on the 7th of March. The individual in the Western Cape is a 36-year-old man who had traveled to multiple countries including Germany, Austria, Switzerland and Turkey. He returned to South Africa on the 9th of March. The other cases so far diagnosed in South Africa are a 38-year-old man in KwaZulu-Natal who was the first case to test positive on the 3rd of March. His wife also contracted the virus. Next, a 30-year-old woman in Gauteng tested positive for the virus. 2 other individuals tested positive in KwaZulu-Natal, but are asymptomatic, and another 38-year-old man who tested positive for the virus showed mild symptoms. Please like and subscribe to HSA News for more updates on the global pandemic COVID-19 coronavirus in South Africa.